It's hard to believe that it has been over 4 months that we've been at this unimaginable, unprecedented coronavirus pandemic.
But through it all, our staff have been wonderful. They've been willing to get up every morning. They've been willing to come in to work to take care of patients. That is their first priority.
The Population Health Division is a team. It comprises the urgent cares, the rural health clinics, community outreach, PRIME, which we now call Care Transformation Program. When everything shut down, the first thing we thought of are what about our patients? What about the insulin-dependent diabetics? What about the frail and elderly that are scared to leave their home? How are we going to help them? They developed the COVID-19 hotline. I mean, it was just such a huge felt need to the community. We field 300 to 400 calls a day and growing.
Infection prevention has truly demonstrated as healthcare is their passion. This department has worked non-stop throughout the clock for reporting, keeping a pulse on the state, the county, and exposure tracking, and making sure that the protective equipment is available to our employees, as well as making sure that our patients are safe.
My teams include the Office of Research, the Simulation Center, obviously all of GME, also undergraduate medical education with medical students and other visiting learners. Ultrasound in general falls under GME, street medicine, and then of course all the office staff here up on the 5th floor. They've all pivoted and adapted to continue doing all the great things that they're doing, but in a way that is responsible both with social distancing and masking.
Clinical engineering has taken great care, as they always do, of our over 15,000 biomedical devices, but including that are our ventilators, which obviously were a big topic during the pandemic. ISS departments, starting with getting hundreds of employees at Coweta Delta working remotely from their homes, but making dozens of changes literally to workflow and our EMR, and almost overnight stood up a telehealth solution so we could start doing visits with our patients while they could stay in the safety and comfort of their home.
There are so many projects that my teams have been working on with COVID, an extra work on top of their already very busy day. These teams now consist of an oversight committee making sure that we do everything on time, according to the guidelines, we don't miss anything. The next team is really focused on expense tracking. The lost revenue team, which is really the financial losses that the hospital has experienced because of the decrease and the decline in patient volume, the billing impacts. There's a great deal of complexity in billing the COVID patients correctly, making sure that the edits are correct. Materials management, our supply system, not only fight the daily battle of finding the scarce PPE and other supplies, but they also help in the distribution of the masks across the districts. In terms of labor, from a standpoint of the whole district, we've had 1,922 people transfer hours to the COVID-related department. They were doing something related to COVID. And if you take all of those hours and you convert them to a full-time person, it was over 209 people worth of extra hours spent on just COVID, on top of their everyday work.
What an incredible experience. There's so many people to thank for just their dedication, their commitment, their selflessness, their sacrifice.
What keeps us going is the smile on patients' faces when we actually have the patient walk down the hallway for patient recovery celebration. It's just a pleasure to see that how we serve our patients, and they are so happy to go back home to their families.
Health is our passion.
Excellence is our focus.
And compassion is our promise. And we are to be your world-class healthcare choice for life.